Everyone. So my name is Leslie Lexier. I came here to Maui about, I don't know, maybe 16 years ago now. I came as a traveler. I was a traveler and registered nurse, and I stayed. I just fell in love with it here, and I stayed. I began my adventure here working in endoscopy surgery center in PACU, and then I moved to quality improvement about 9 years ago, which I absolutely loved. And when I saw the job posted, I had no idea truly what quality management or quality improvement did. And I kind of asked around, I asked my colleagues, and everyone kind of had a vague idea, but not a really great idea. So we're going to talk for the next half an hour about what quality management is. So what is quality? It is meeting the customer's needs. And it's the customer that defines what their needs are. It's always making sure that we're doing the right thing. Are we doing it kindly and respectfully? Are we doing it timely and efficiently? And ultimately, are we doing it safely? Number one, right? So what is performance improvement? Performance improvement is a continuous examination of how the hospital functions and processes. And this is 24/7. We're always looking at ways to improve. And we want to better meet the needs of our patients and our customers. So performance improvement. How many of you were brownies or Girl Guides or Boy Scouts? You remember be prepared. We were always prepared. So as a nurse, as a healthcare professional, this is my motto: doing the right thing for every patient every time. We want to focus, of course, as we said, on what's important to our customers. We want to focus on improving things and not improving things after a sentinel event or after a bad outcome has occurred. We want to be very proactive. And the ultimate goal, always providing that safe, quality care for each and every one of our patients. So what are our goals for the performance improvement plan? Well, we have a performance improvement model. And here at Maui Health, we use the PDSA, the plan, the do, the study, and the act. And we prioritize it. We ensure that it's multidisciplinary and it's collaborative. How many of you just graduated recently from nursing or have a higher degree in nursing? It's all about interprofessional collaboration now. This is evidence-based. They've discovered if everyone's working as a team, everyone's working collaboratively, we're going to have better patient outcomes. So we want to benchmark. You know what benchmark is? We look to see how we compare to the rest of the nation. Are we doing as well as the rest of the nation? Hopefully, if not even better. So we're always looking to see how we compare with other facilities. And we always want to make sure we're compliant with Joint Commission and other regulatory agencies. So who are our customers? Take a look. There's a lot of customers. Look at the very bottom. You are a customer. You come here and you hope that we are having our processes and systems in place for you to effectively do your jobs. So PI focuses on processes and systems, not individuals. We're not looking at bad employees. We're just making sure our system is running smoothly and effectively. But did you know that all issues come from problems with processes and systems? Can anyone give an example of something that happened in the state of Hawaii about 3 years ago? That someone triggered an alert to go on. And that alert caused a huge uproar in the entire state. Who wants to guess what that was? You remember?
The missile warning.
The ballistic missile alert. That went off. Now this was an issue with their processor systems, because how could one person cause this alert to go off that affected so many people? So I bet you they looked at their processes and systems after that happened. So how does PI affect my job? Well, truly, in your hearts, please know that every single one of us in this room makes a difference. What you contribute is crucial and vital to the care that we give to our patients. And of course, the collaboration, again, is just so important amongst all the different departments and areas within the organization. So how does PI affect my job? Customers are satisfied, employees are satisfied. Isn't it nice to go home at the end of your shift and know, hey, I made a difference, I did a good job. Gosh, that felt good today at work. And PI is at the core of every mission of every employee, and we reduce costs ultimately. So how do we choose what processes we want to improve? We want to look at processes that are high risk, high volume, problem prone, new, and redesigned. This is our PDSA that we talked about, the plan, the do, the study, and the act. So in the planning section, we ask a whole lot of questions. We make a prediction. What do we think we're going to find? We're going to address the who, the what, the why, the when, the how. Then we're going to go ahead and do it. We're going to carry out that plan. And this is where the analysis of the data begins. Then we're going to study it. Hey, was it what we predicted? Did we find what we thought we were going to find? And then we're going to act on it. This is the performance improvement flow. So let's start at the very bottom. For example, if there's a complaint, a patient complaint, and this is where it goes, all the way up to all these different committees and councils, and ultimately we report to the board of directors. There are two separate committees and councils that meet. The Quality Management Committee meets once a month, and look at all the topics and the issues that they address on a monthly basis. That's a lot. And then the Patient Safety and Quality Council meets monthly. Quality Management Committee is separate, and this is more on a department level. So who cares? Why do we do all this work? Why do we do performance improvement? Why do we benchmark and look at other people's data? Well, it's required. It's the Hawaii Revised Statute Law. The Joint Commission cares. The Centers for Medicare and Medicaid cares. A lot of insurance payers care. But guess who ultimately really cares? Our patients, right? But us, every one of us in this room. If we are a patient one day, this is where we're going to come to. This is the only acute care hospital on the island. So we care. We want to make sure that this hospital is giving safe, quality care to each and every one of our patients. This is where we might come to as a patient, our neighbors, our family members, our friends, our community. So we care. Have you heard of the National Patient Safety Goals? They're posted every single year. You get a new sheet posted on every single unit. And this is established from the Joint Commission. And they look at processes that are identified as contributing causes to sentinel events. So these are high priority. These are opportunities for improvement that benefit patients. It'll help improve the safety of our patients. High importance that every time Joint Commission comes to do a survey at any hospital, these national patient safety goals are addressed. So here's the first goal, identifying your patients properly, accurately. Here we use the full name and the date of birth. Those are our two identifiers. Is anyone going to be working with newborns? So they have double bands with mother and baby. Anyone working behavioral health? They have a photo and a barcode as their ID. And anyone working with unidentified patients, perhaps emergency room, I'm thinking ICU, maybe the OR, they will have a unique band. Secondly, we want to make sure there's no blood transfusion errors, so always making sure we're giving the right blood to the right patient. Improving staff communication. We all know communication is crucial to the safety of our patients. Critical lab results must be reported to the appropriate person within 13 minutes. That is our policy here. We want to make sure we use our medications safely. If there's a medication you're taking from one container and putting it into a second container, it needs to be detailed on that medication container. We want to reduce the likelihood of harm with the use of blood thinning medication or anticoagulant therapy. Look at all the people that are involved. The physicians, the pharmacists, the dietitians, the nurses, all of these people as a team are responsible for blood thinning medication. We want to make sure when patients come in, we want to know what are they taking, what are the new medications they're taking, and we want to make sure that medication reconciliation sheet is accurate, because when they go on, when they're discharged, and and they move on to the next provider, that provider can continue safe care by looking at that accurate med reconciliation sheet. You want to prevent infections. Take a look at that. Did you know millions of people every year acquire an infection while receiving care in a healthcare facility? What's the most important thing we can do? Hand washing. More important than ever now, right? So we want to prevent infections. There are all kinds of infections that a patient can get in the hospital. The CLABC, the central line associated bloodstream infection, an infection after surgery, or an SSI, a surgical site infection, a CAUTI, a catheter associated urinary tract infections. We want to prevent all these things. We don't want our patients to get any infections while they're here. Always make sure when you're in charge of a procedure being done on a patient that it's the right procedure on the right patient at the right time. Anyone working surgery center, endoscopy, OR, so you know you've got your pre-op checklist here. You're gonna mark that operative site and that ever most important timeout process where it's quiet in the room and every team member together identifies the patient. So what is a UOR, or an unusual occurrence report? This is our standard reporting mechanism that we use here at Maui Health. And we report any safety, quality, or process improvement opportunities. Anyone could fill out a UOR. It's super easy. You don't even have to have computer experience. And if 1, 2, or 3 of you want to report about the same incident, please do, because the more information we have, the better. This is your homepage. When you open up your computers, this is what you're going to see. And up there on the top right is the UOR, your unusual occurrence report. Click on that, and this is what you're going to see. There are required fields that you do have to mark, or you cannot progress on to the next area. And look at all the different selections. So choose what is most appropriate to what you are going to be reporting. If you don't see it, just go to Other. So what do you want to report? Anything that resulted in harm, any sentinel event that occurred, which was a death, a permanent harm, or a severe temporary harm, any occurrence which resulted in a dispute, claim, or a lawsuit. What happens if it's a near miss? You were going to give a medication, for example, and you saw that it wasn't the right med or the right dose, and you were on it that day and you said, nope, this patient is not going to get this, not on my shift. So that was a near miss. Do you think you would report that? Yes, please, because you want to make sure that this doesn't happen again to someone else. So please report it. What if you're the first person taking care of a patient and you roll them over in bed and you see a great big pressure ulcer? Do you think you would report that? Yes, we want to make sure everybody knows this was not acquired in the hospital. So value-based purchasing. Did you know we get bonus payments? We get bonus payments for how we perform and the outcomes of our patients. So there's 4 different areas that value-based purchasing looks at. 25% of the weight goes towards the clinical outcome. They look at any mortalities that happen, any complications that occur. 25% of the weight goes towards the patient survey, the HCAP survey. Almost every person that goes home from the hospital gets a survey when they arrive home, and the patient or the family member fills it out. And the results of that survey affects how we get reimbursed. It affects our bonus payments. They look at the safety of care. Was there any hospital-acquired infection that occurred? And lastly, they look at the cost of care. What if a patient came in, for example, for a routine surgery, they ended up falling in the hospital, went back to the OR for hip replacement, got back to the floor that they were a patient on, and then they died. What do you think the cost of care would be for that patient? Through the roof, right? So that's your value-based purchasing. And breaking down the HCAP, the survey, look at all the different measures that are looked at and asked about. The communication between nurses and doctors and the patients are addressed. The responsiveness of hospital staff. Did the staff respond promptly when the call bells were tolled? Was it clean? Was it quiet? Quiet hospitals are a main driver for every hospital. Really keeping in mind that patients are here to heal and rest and recover, so it's really important to have a healing atmosphere. And the discharge information, and they overall rate the hospital. So 25% goes to the patient survey results. Hospital-acquired infections, these are all the infections that could possibly occur when a patient comes into a hospital that we want to make sure that we prevent. There's also a hospital readmission reduction program. This came about in 2010 with the Patient Protection and Affordable Care Act. Do you know what the main driver for this program was? Out of these diagnoses is what is looked at. But one of them, there was so many excess readmissions within 30 days that's why this program was established. Does anyone want to take a guess what the main driver was? Which diagnosis?
Heart failure.
Yeah, heart failure. 6.5 million Americans have heart failure. Guess how much it costs healthcare a year? $39 billion a year. So it's one of the biggest drivers, but all of these diagnoses are evaluated on that if patients are readmitted within a 30-day period, we do not get fully reimbursed. There's also a hospital-acquired conditions reduction program. They evaluate hospitals on any of these conditions that could happen after the patient is admitted, and the hospitals could be penalized for poor performance. So we do clinical quality measures. We report quality measures to the Centers for Medicare and Medicaid, to the Joint Commission. We actually participate in a program called Get With the Guidelines that's sponsored by the American Heart Association and the American College of Cardiology. Get a flyer here. So we do so well in this quality improvement program sponsored by the AHA that we are listed in the U.S. News and World Report magazine as one of the best hospitals in the nation. We have been in this magazine for multiple years in a row. And this is for the care that we give to our heart failure patients and the care that we give to our stroke patients. So we're really proud of how well we do with our quality measures. And we are being recognized for it because our patients are receiving best practice, evidence-based care. This is how we benchmark and look at our data over a 3-year period. This is us in quality looking at all of these different topics and how we see if we're on target or not. So who uses all this data? Well, as we said, Medicare, Medicaid, the state, commercial hospital rating companies. Leapfrog is a hospital rating company. It's a private company, and they rate every single hospital, I believe, across the nation. They give it a grade. We also are on the Hospital Compare website. If you want to Google Hospital Compare and get our hospital up, you can see how we do. And right now, we are at a 3 out of 5. We were a 4 out of 5 up until recently, and we lost that 4 out of 5 star rating by something like 0.05%, some really minuscule amount. So we're back down to a 3, but we're hoping to climb back up again. But every hospital can be looked at to see how they compare, how they're doing with their safety and other measures. So teamwork equals success.